Hello, everyone, and welcome to another episode of Innovation Impact Makers. We speak with people quietly making an impact in the world of innovation. It's not every day that you meet somebody who's making an impact on something that impacts all of us, which is the cost of things. My guest today is Assaf Frajman, the CEO of Octi Health. Welcome to the show.
Thank you, Naftali. It's great to be here.
So Assaf, first tell us a little bit. Your journey is kind of interesting. You studied medicine and then you went
hmm
into entrepreneurship. Tell us how you got into that.
Yeah, perfect. So, yes, as you said, I started in my professional way in med school. I really enjoyed it. I liked it. Came to the realization, I think it was the last year of med school, that I don't want to practice medicine. And I graduated summa cum laude and pivoted my career to the tech industry. I have to say that I did meet my wife in med school, so it wasn't a complete waste of time. But I started my journey in the tech industry and I started Octi, my current venture, along with my two truly great co-founders, Ori and Nadav, roughly, I think 12 months ago. And I think so far, I think that I've made the right decision, but only time will tell, I guess.
So this is your first foray into entrepreneurship.
Yes, it is.
What do you think of it? What?
Wow. Well, so I think that this is an emotional roller coaster. Some days you feel like you can do anything, and I feel like I'm winning and things are going just great. And on other days, I feel like exactly the opposite. Nothing works as the way I want it to work. We can't make any progress, and so there is like the difference between days and even hours sometimes are so big, and you move between extremes of being happy and hopeful, and in other times desperate and pessimistic. I think that's, to me at least, that's the main thing, that the highs are so high and the lows are very low.
When I spoke with other founders, one of the things that they mentioned about keeping them going was the focus on making a difference and making an impact. Tell me about OptiHealth. What kind of impact are you trying to make with that? Tell us what it's all about.
So what we do, and I think I can, what you said really resonated with me, because we make impact. We turn people's life to be better. So what we do in the US, healthcare costs are a huge problem. The American healthcare system is, to put it simply, broken. And people with solid insurance still have to pay a lot of money out of pocket. And this is the leading cause of bankruptcy in the US. 41% of Americans have health-related debt. And the thing is, there are ways to lower medical bills. And this is what we do. This is what Octi does. We lower medical bills for American employees by 61% on average. And it means that, let's say you have good insurance from your employer and you went to the ER and you were discharged a few hours later, but now you owe to the ER, let's say $3,000, which is a lot of money. And you can come to us, to Octi, and we can help you reduce it, as I said, by 61% on average, and saving you a lot of money.
How does Octi do that?
So that's the magic. So what we do, we make sure that you were billed correctly, that your insurance policy was applied correctly, that you received all the assistance and aid that you are eligible to, and we negotiate on your behalf. And your behalf meaning on your behalf as an employee or a user of Octi. And when you combine all like these, we call them the four pillars of Octi. When you combine those four pillars, you get this massive discount.
Who are the customers? Are the customers the employers, the insurance companies, the actual employees themselves?
So what we do, we see Octi as an employee benefit, meaning that we sell Octi to employers, and they offer Octi to their employees as an employee benefit. I think that the value proposition for employees is pretty clear, right? Everyone loves saving money. But we also help employers directly. So first of all, we know how important benefits are for employees. So when employer offers better benefits, it means better retention, satisfaction, productivity, well-being, and so on. So this is first. And the other thing we can help employers with is directly reducing their healthcare costs. When we help employees save on their out-of-pocket expenses, it means that in various ways, the employer also saves money. And healthcare costs are usually the second largest item in an American employer P&C, P&L, I'm sorry.
Just so I understand, you're targeting the employee's premium that he has to pay if he has to go to the hospital, let's say, or something else. That's what you're targeting, or you're targeting the overall cost of the insurance plan.
So what do? We target the employee's out-of-pocket expenses. So an employee has health insurance, and the policy is usually built that contains deductibles and co-insurance and co-payments. Those are the costs that the employee has to pay out of pocket, regardless of the premium they have already paid.
So for example, I have home insurance. So if I have to use it, I have to pay a certain amount today. It's very small, but I have to pay a certain amount where the actual cost for the repair, for example, might cost a lot of money, a lot more money. So my portion is small. So you're targeting that deductible, as it's called.
Exactly. But for the individual, this is usually not very small. The average American can't afford an unexpected $500. And when you go to the ER, your bill, or to a hospital, or you receive any kind of medical service, honestly, your bill can easily be $1,000, $3,000, $5,000, $8,000. So the average American just can't afford it, and then they go into debt and start finding ways to pay for these out-of-pocket expenses, despite the fact that they do have insurance.
How does Octi save money for the employer?
So what we do, there are two ways. If the employer is self-insured, meaning the employer is the payer, the employer pays for the employee's claims, we help find and remove services and items from the bills that shouldn't be there. For example, true story from 2 weeks ago, I think, we helped one of our broker partners with his personal medical bills. He went to the ER, and there were several issues with his bills. But one of them was that he was billed 3 times for a service that can only be billed once per day. And each time, I think it was $938 each. So removing 2 items out of the 3, meaning we saved both the broker as an employee and his employer, $1,800 combined. So this is what we do for self-insured employers. For employers who that are fully insured, what we can do is we can help move some of the employees, those who are interested in it, to insurance plans that have actually higher deductible, because higher deductible means lower premiums, and the lower premiums are shared, like the savings are shared by both the employer and the employee. If you are, let's say, young and healthy, you usually don't need to buy a premium, so you can save money on and paying lower premiums, save money. But you know that once you do receive medical service, you will have to pay a lot of money out of pocket. When you have Octi, those expenses, those out-of-pocket expenses, will be lower, which makes it easier for you to opt in, to choose those plans, high deductible health plans, as they are called, over the more traditional PPO or other health plans.
Everything now is AI, so I assume the engine running Octi is running an AI. So did you develop your own model? Can you explain a bit more about how the engine that works behind the scenes?
So you are right. Everything is AI, and what we do wasn't possible or was very hard just 2 or 3 years ago. In order to analyze medical bill, you have to have expertise in medical billing, medical coding, clinical medicine, insurance, different regulation in the federal level, in the state level, different laws, again, in the federal level and in the state level. So there are many different fields of expertise that need to be combined into one workflow. And this is what we do. We use different AI agents, each one with a specific knowledge in a specific field. And some of them are even generated ad hoc per specific case, meaning that if you, let's say you were hospitalized because you had some heart problem, okay? So we need an agent that is an expert in cardiology. So we will generate a specific agent in cardiology who specializes in cardiology. And if you went to the hospital in Texas, so we need someone who understands the local laws and regulations and so on. So we, as I said, we use different agents. One is an expert in its own field, but each one is modified and adjusted to each specific case. So we have individualization and personalization at a huge scale.
If you're doing that with different agents, does that add to the overall cost of your offering?
Yes, but it's not, I think, yes, but not that much.
So who interacts with these agents? The employees themselves?
No, so with the employees, the app is very simple. People, Americans, are very intimidated, like all of us, by the healthcare system. And when it comes to health issues and financial issues, and trying to understand and make sense of all of this. So we've built our system to be as easy and as user-friendly as possible. So from the employees, from the user's perspective, the app and the system is very simple. The onboarding takes roughly 2 or 3 minutes, and then we guide the user through the process of retrieving the necessary documents, and that's it. From that moment on, we handle the entire process on the employee's behalf until the bill is finally adjusted.
So the agent is operating in the background and not in the foreground.
Yes, yes.
From deploying this, what is the reaction of people using it already? What do they have to say?
People love it. People love it. Think about it. As you've lived in the US, right?
Not for a long time. Not for a long time.
Not for a long time, but for enough.
I think here in Israel we don't have to worry about these things as much because we don't have to usually pay out of pocket for these types of things.
Yeah, you're right, correct. But Americans, they see healthcare costs as a part of life. They view it the same way they view paying their taxes. Okay, that's just the way life is. There's nothing you can do about it.
Necessary punishment that you have to go through.
Exactly. Yes, that's a necessary evil. And most of them don't know that you can lower your medical bills. They think that when they go to the ER, they are going to get hit with a huge medical bill. And that's it. There's nothing you can do about it. And that's not true. So when someone comes to Octi and they have, again, a case from a few weeks ago, the bill was for a woman who took her baby to the ER, and the baby was there for 54 minutes. That's it. She received no IV medications, no imaging, no labs, nothing. She was discharged and received a bill for $3,000.
It's great for the hospital. They get all this money for doing nothing. But
for doing nothing, yes, nothing. And we reviewed her case, and we found out that she was billed for a level 4 ER visit. But that was probably a level 2.
That doesn't sound very legal, if you ask me.
So that's the hard part. It's not that it's illegal, but I would say it's a gray area.
Price gouging.
Yes, it's called upcoding. This is extremely common. And the difference between a level 4 ER visit and a level 2 ER visit is $1,600. Now think about this woman. She prepared herself that this ER visit would cost her a lot of money. She received this bill, this $3,000 bill, and she came to us. She probably expected nothing. And then we told her that she can now save $1,600.
Wow.
That's huge. So people are thrilled in many cases because it seems to them impossible, and now they saved a lot of money.
How much deployment has there been in the US? How many users do you have? How many people are using it?
So we now have a few thousand that work with Octi. We have 9 broker partners who bring Octi to their employer clients and to their employees. We've only started it a few months ago, so we are picking up traction, and I think that many brokers and the employees understand the value. The value is very easy to understand. There isn't a single American who hasn't faced it firsthand, like hasn't felt it firsthand, or at least knows someone who has, a family member, a friend, and so on. And I think that the sentiment, like what people feel about the healthcare system and health insurers is well, I'm sorry, I have no better term than say that they hate the system. They feel that the system doesn't provide the service it was built to provide. And I wouldn't say it doesn't provide a service, because it does provide the medical service, but at prices that are just unsustainable.
The quality is high, but the level of customer satisfaction is extremely low because of the prices.
Exactly, yes. And you think about the average American employee. They have been paying for years premiums, very high premiums for years. And now they go to the ER and they are hit with a $5,000 bill. And they start to ask themselves, so why I was paying these premiums for years now, if when I go to the ER, I have to pay $5,000 out of pocket.
What additional features do you want to add to this in the future? I'm sure you've thought about adding more to this. What do you have in mind, if you can tell us?
So what we will have in the future, we will know. We want it to be even easier for the users to use it, and to make the app proactive, meaning that we will reach out to you whenever something happens, and we will begin the process at that point.
So that means that it'll actively take, a person has to go to the emergency room, let's say, or actually start the process so that it will take place before the bill comes, or it'll still take place after the bill comes.
As soon as possible, whenever is possible. Yeah. And made it easy and simple. And we want the users to have this experience of not having to do almost anything. We want them to do nothing, or as little as possible.
You want them to pay less. That's a big impact.
That's the greatest impact, but we want it to make the experience better, to make them feel that we are there for them and we do all the heavy lifting.
Right. Wow. Assaf, it's amazing. I'll be following you for sure. I want to thank you for joining us today and explaining what you're doing. Thank you very much.
Thank you so much for your time. It was a pleasure. Thank you so much.